Hello and welcome. I'm Dr. Carl Gold from Health Best International, and I'm here to introduce you to the newest breakthrough in cutting-edge veterinary ultrasound. And by that, I mean a wireless ultrasound probe that can transmit directly from the probe to any viewing device via an app. No cables, no wires, completely portable, and includes 3 ultrasound systems in one: a linear system, a curvilinear system, and built into this end of the probe is a phased array system for better cardiac imaging. The app runs on iOS, Windows, or Android platforms, so you can use it on smartphones, tablets, laptops, or desktops. It's easy to use, provides incredible images, and handles your exam types from head to tail, all in a single unit. And without having to move your clients to another room or approach them with a cable or cart, it's easier for you to navigate and easier on the animals, who stay much calmer. Now you're able to scan any animal under any condition at any time and provide outstanding ultrasound images. Price point, portability, and image quality make this a true standout in the ultrasound market. So today I'm going to give you a little demonstration of how the probe works, what you can do with it, and how it fits into your veterinary practice. The first thing you need to know is that it transmits the ultrasound signal from the probe to your viewing device using a built-in 5G router. So you never need any outside connections or networks. Once the probe is connected, I pull up the app and I'm ready to begin scanning. By using either the button on the probe or the freeze button on the app, I'm live and ready to scan. It's a fully functional ultrasound system and with all the controls you need to optimize an image, and it's incredibly easy to use. Once I have the image that I want, I'm able to freeze the image on the screen, and now I'm able to do post-processing. And by that, I mean on-screen measurements, annotations, or creations of video or cine loops. Now I'm ready to show you how easy it is to scan. So let me bring in my friend and collaborator, Yoshi, and show you what the ultrasound probe can do. So here we are. The important thing to notice is since I didn't need to move him to another room, bring in a cart, or approach him with the cable, he's cooperating nicely for the exam. He's calm and easy to work with. Yoshi's ordinarily a nervous kind of fellow, but he's cooperating nicely with the exam, and I'm getting great images. So I'm starting in the midline below the xiphoid. I can see the liver. I'm moving the probe to the right. Eventually I come to the stomach, which is seen here. From there, I travel down the right costal margin and will pass by the tip of the spleen there, through the spleen, and ultimately down the right costal margin I'll find the kidney. This is Yoshi's right kidney. I'm going to examine it from superior to inferior, and then from lateral to medial. No stones, no dilation, no abnormalities. This is a normal kidney exam. As I leave the kidney, I'm going to switch functions and scan down the middle of the abdomen to the bladder. That's the tip of the liver before I go in caudad. Here is now the bladder coming into view, and I will again examine it from cephalad to caudad. The lining here seems to be a little bit thickened. It's an interesting finding. We'll have to follow that up. Now I'm going to switch ends of the probe and show you the phased array probe first. This will be a subcostal view of the heart, where you can up through the apex and up through the outflow tract. All 4 valves are visible with various angles here subcostal. Here's a transthoracic 4-chamber view, again using the phased array section of the probe. I will switch now to the show you how on-screen measurements work. Here's the bladder as my example. I come to measurements. I can do a length. I can do an angle. I can do an area and circumference measurement. And finally, I can do a trace of an irregular shape, but still obtain the area of the trace. Once that's done, I can save the images, either the single image or the CineLoop. Here I can add an annotation to the screen as well, either labeling or notes. Here I'm saving the image to the hard drive. The other function I'd like to show you is the color Doppler so that you can evaluate vasculature. This is the femoral artery in Yoshi's right leg. Here you can see clearly there's good flow in the artery. Here's a hepatic vessel. I've moved back up now, subxiphoid midline, and I can determine hepatic blood flow. From there, I would like to demonstrate to you the pulse wave Doppler feature. This is where I can measure flow velocities. Here I'm in the femoral artery. I take the freeze image of the vessel, each cardiac cycle. Displayed in the bottom half of the screen, I can measure velocity, heart rate, and the systolic-diastolic ratio, which ultimately gives me the resistive index. So it's great for vascular analysis of any kind. And to wrap up, I'm going to show you the curvilinear end of the probe. Here we're looking at Yoshi's kidney in the center portion of the upper screen, scanning cephalad to caudad. The next part that I'll be showing you is the on-screen targeting system for needles. I will show you first the in-plane targeting guide, and then I will show you the out-of-plane targeting guide. You can move each of the guides so that they are over your target and have a clear view of where the needle is going. Once the image is on the screen, you'll also be able to change where the image sits. You can change from left to right. Here I'll show you that moving the one to the other, mirror image, and I can also go superior to inferior. And that wraps it up for the probe. Okay, so here we are, all finished. Cleanup is very easy. Any clinical wipe will do. Alcohol, chlorine, etc. And now the device is completely clean and ready for the next exam. The battery life is 3 hours of continuous scanning, so you never have to worry about running out of power. Should you need the probe for surgical procedures, we also have a sterile sleeve. Just drop it in, seal it up, and it's ready to go. It comes with sterile gel, and it's very easy to use. No more of those ridiculous long plastic sleeves that get bunched up and get gel all over everything. So from simple exams all the way up to surgical procedures, you're ready for any situation. And if you're mobile in your practice, you're able to take this with you anywhere. Even if you just need to move from room to room, it's literally a matter of putting it in your pocket and bringing it out for the next patient. You're ready to go. And lastly, the price, under $5,000. Instead of $20,000 to $80,000 for a laptop or cart system, which, by the way, are way too heavy to lug around comfortably. Compare 6 ounces to 20 pounds or more. And here's the icing on the cake. Using ultrasound, you attract referrals, add more procedures, impress your clients, make your own life easier, and dramatically increase your revenue. With current pricing for ultrasound services, your return on investment is complete after about 30 exams. Do the math. It's a no-brainer. So, if you'd like to be on the leading edge of veterinary practice, please contact us. Our information is here on the screen. We'll be happy to answer your questions, provide more information, schedule a one-on-one live demonstration, or even arrange for you to try the probe for yourself. Once you see it in action, I'm certain you'll understand how valuable it can be for you. Thanks for your time, and I look forward to speaking with you. I'm Dr. Carl Gold, Chief Medical Officer for Health Best International. Bye now.